Hello, I thought I would jump on the video today because I've been asked to write some work for Haemophiliac Awareness Week. And essential oils have a profound effect on the clotting capacity of blood. So if you are somebody who suffers from haemophilia or von Willebrand disease, or if you're like me, you're a thrombophiliac, maybe you have something like factor V Leiden or something that means that your blood thickens, then this will be of interest to you, because if you're given if you're given anticoagulant medications like something like enoxaparin, heparin, clexane, warfarin, any of those things that already thin the blood, then so we have to be very careful about mixing them with them. So in this video, I'll go through essential oils that are likely to thin your blood. If you are taking an anticoagulant medication, if you suffer from a platelet clotting disorder, and so you have platelet deficiencies, so maybe haemophilia, but maybe a number of different conditions where your blood doesn't clot, then we don't want to be giving you oils that are going to stop your blood clotting even more. And likewise, as well as the ideas about the medications that you're on, we also don't want to be giving you essential oils for blood clots if you are about to have surgery. We don't want, because we don't want to thin the blood and make it less likely for it to clot while you're on the surgical table, obviously. And that just doesn't necessarily talk about just having, I don't know, some kind of gallbladder removal or whatever, but also think about tooth extractions. We don't want those to bleed too. So let's have a think where to start. There are sort of 3 areas in the body where essential oils will interact to cause difficulties. So let's go through those in turn. So the first and most regular action will be on a fatty acid called arachidonic acid. So arachidonic acid's job, it has actually lots of jobs, but one of them is involved in thickening the blood. So what it will do is arachidonic acid touches on enzymes, and then it will turn those enzymes and thicken them to become prostaglandins, so they have an inflammatory nature to them, and then it turns prostaglandins to thromboxane. Thromboxane is what causes a blood clot. So that's the first thing, that we have lots of oils that will affect arachidonic acid to stop that cascade, so the thromboxane's not made, and so a blood clot can't form. So that one is more of a preventative, but of course it will also, over long term, stop blood clots. Another way that essential oils for blood clots work is that they can interact with vitamin K. Vitamin K is given to babies when they're first born to make sure that their blood will clot. And vitamin K is also not only for blood clotting, but also for improving bone density. There are essential oil constituents that will interact with vitamin K, and I'll go through which one it is in a minute. And then finally, we have an interaction through the liver. So let's start there. So warfarin is metabolized by the liver by specific enzymes in the liver. So in particular, we're looking at medications that are metabolized by cytochrome 450. And right, I've got my notes here, make sure I've got the right numbers. So grapefruit essential oil, food, juice, any kind of grapefruit has a theoretical interaction with warfarin. So this is why. So these cytochromes, CYP3A4, CYP1A2, 2A6. Those are the 3 enzymes that anything to do with grapefruit will interact with. Warfarin also interacts with CYP3A4 and CYP1A2, and it's harder to see when it's not written down, but you would be able to see they're the same ones. So warfarin is being metabolized by that particular enzyme, and so is grapefruit. So this is important. So we say that there is a theoretical interaction between grapefruit essential oil and warfarin. And the doctor will have told you, don't eat grapefruit, don't drink grapefruit juice. So this is why. So that's the first one. We want to avoid grapefruit. There are a lot of different essential oils that are affected through this arachidonic acid pathway. So there are sort of 3 main constituents that we need to be interested in. The first, and possibly the most important one, is called anythol. So anythol is something that gives things aniseedy smell. So anythol has a profound effect on blood thinning. It will thin the blood very, very quickly. And the scientists who did the experiment said, if you use anythol, or if you use fennel essential oil, and anythol is in fennel, but not a huge amount to be honest, you'll get the same effects. So fennel is extremely good at thinning the blood. So again, to reiterate, if you are on medications that thin the blood, you don't want to be using fennel. And also, it's one of those, fennel's an oil that's got lots of interactions with blood thinning, with diuretics, with pregnancy and stuff. So just really check your safety before you use that oil. The other ones that you will expect to find anythol in are star anise and anise. And I'm just regretting my life choices now because I didn't write down exactly how much anythol's in them. But we're looking around, both of those, we're looking around about 90% anythol, if I remember rightly. So the next constituent that we're interested in is one that you will probably be more familiar with, and that is eugenol. And if you think, oh, I do know it, but I'm not sure why, eugenol is why we love clove. Clove essential oil is extremely powerful antimicrobial because of eugenol. So eugenol is really, really popular for coughs, colds, that kind of thing, because it will kill pathogens, but it also thins the blood. So eugenol we can expect to find, as I say, in clove. Another one that I am very keen on, one of my favourite oils, is holy basil essential oil. And if you want to know more about that oil, I've written a book about it that you can find. If you look in my Linktree, you'll see my books. And also bay. So those are ones that we need to be really quite careful of. Another oil that we need to worry about with essentials for blood clots is cinnamon. And by that I mean both cinnamon bark and cinnamon leaf. They've actually got 2 constituents that we need to be worried about here. Cinnamaldehyde thins the blood, but also coumarin. And again, it's this interaction with arachidonic acid that we're concerned about. Maximum dilution of those is very different, so be careful. Cinnamon bark, only small amounts. We want a maximum dilution of 0.7%, but we can use as much as 5% with cinnamon leaf. So to be clear, if we are trying to deal with blood clots, then we're happy to use these oils. But if we already have a platelet disorder, if we're going into hospital for an operation, or we're already on blood clotting medications, then we don't want to use these at all. And I would really heartily recommend that you go and talk to the doctor about them. The medications are very powerful that we use. I am very grateful for the ones that I had, but they are expensive. And so if your doctor is happy for you to have a look at those, he can find the interactions for himself in the book I talked about earlier, Essential Oil Safety for Health Professionals by Robert Tisserand and Rodney Young. Carvacrol. Another one of those constituents that we know well but can't go, I don't know what it's in. It's in oregano. So apart from anything else, it's oregano, marjoram and thyme are the main ones that you'll probably come across about it. Again, same interaction, arachidonic acid. The final action that we are worried about is this interaction I spoke about with vitamin K. And that is, we're going to be worried about that with wintergreen essential oil. Now, when I first qualified, back when dinosaurs roamed the earth, we weren't allowed to use wintergreen oil for exactly this reason, because it is tremendous for pain, for like fuzzy migraines or for sort of arthritis, those kinds of pains. And it's got a really weird energetic. So when you put it on, it's really cooling and then it warms up the skin. So it's popular in things like liniments, but also in toothpastes because it's very good for the gums. So one of the problems that we have is that particularly elderly people who are already quite prone to problems and are on blood thinning medications, they like their liniments for their joints. So particularly Tiger Balm. Tiger Balm has wintergreen in. So the difficulty is if you're using wintergreen and they're already using a wintergreen, they don't even think about telling you when you are asking them about medications the doctor's prescribed. The doctor didn't prescribe it, so I didn't tell you, and they are going to overdose. So we need to be really careful about wintergreen. So this oil is, off the top of my head, can't remember the exact percentage, but I think that 97% methyl salicylate. No, methyl salicylate. And salicylate is a blood thinning, I'm going to say organism, no, compound. So the doctor might say to you, you should take a half an aspirin each day to thin the blood, to guard against clots and cholesterol and all of those things. Aspirin is salicylate. So the aspirin thins the blood, stops clots, guards against strokes. And so that's like the aspirin level. Methyl salicylate, off the top of my head, I believe is supposed to be 30 times as strong. So consider how much bigger that is. So if we are using it, we're using really small dilutions. And we're looking about, excuse me, 2.5%, that's it. And the other oil, which potentially you're unlikely to come across, because it's not so popular, is sweet birch. But sweet birch, again, methyl salicylate, and it's around about 90% of that. So those are the main things that I want to tell you. If you are the other end of the scale and you say, yeah, but I have haemophilia, what about making blood clots for me? So we'd go for the oils that we would say are for wound healing. So for instance, myrrh, or helichrysum, rose, those things that are extremely good for healing the skin. They are styptic. The other one that's really good styptic is geranium. They congregate and cluster platelets and should be helpful for you. So hopefully that's helpful. I can't stress to you enough, if you are going to use these essential oils for blood clotting, please do check the safety data and maximum dilution of the oils, because they're all very strong oils, and some of them, for example clove, we only want like 0.5%. We don't want to go overboard, but I hope that's helpful to you, and I'll see you soon.